Director Ayala from DuPage County, Director Arwadi, and Dr. Ezike to discuss the latest update on the state of COVID-19 here in Illinois. First off, I want to address the guidance that we have offered regarding social distancing and event cancellations. I want to thank many of our residents who have taken these guidelines to heart. I know this is hard for everyone. That said, we saw a lot of crowds out and about today, and I need to be frank. We can have a massive positive effect on bending the transmission curve, thereby saving lives, if people will take this seriously. We have seen positive results in countries that took aggressive action, and we have seen tragic outcomes in countries that did not. If you are young and healthy, listen up. We need you to follow social distancing guidelines too. You may only have mild symptoms for a few days and may think that you're just fine, but you can have the unintended tragic effect of spreading COVID-19 to others who may be more vulnerable. Please, please do the right thing for your community, for your friends, and for your family. So once again, no matter how healthy you feel, if you can, stay home. If you are able to telework, do so. If you don't have to travel, don't. This isn't forever. This is a sacrifice in the short term to help our hospitals, our healthcare workers, our testing labs, and our vulnerable and elderly residents. Every action that we take to control the spread of this virus and prevent our medical infrastructure from dealing with too many cases at once is an action that saves lives. Every day that we follow social distancing protocols, we save lives. I also want to take a moment to lay out what a person should do if they think that they might have COVID-19. Our Department of Public Health is working around the clock to make sure that providers statewide have all the latest procedural guidance. But I want to make sure that all our residents know what to do and what to expect if they or a loved one thinks that they might be sick. Step one, call a healthcare provider. Don't just show up, call first. That can be your primary care physician, a health clinic, or an emergency department. But please do not walk directly into an emergency room unless your condition is of a dire nature. The doctor will ask on the phone about your symptoms and if you have recently traveled, as well as talk about other potential exposures. If the healthcare provider thinks that you need medical care, and not everyone with COVID-19 will need medical care, they will help make arrangements for you to seek medical treatment in person so that the risk of exposing others, including people in the waiting room and healthcare providers, is reduced. At that point, healthcare providers will isolate you for further assessment. If you meet certain criteria, a physician may test for COVID-19. But we are prioritizing those with severe illness and those at higher incidence of complications, such as those with weakened immune systems, older adults, and those with medical conditions such as heart and lung disease. Public health officials are working expeditiously to identify all close contacts of cases and follow up with individuals who test positive. Again, not everyone who wants a test is going to need a test. People whose symptoms are mild, and that will be most people, will be able to isolate at home during their illness and will be asked to do so. I know that all of these asks are difficult personally and financially for some of our residents more than others. And I'm doing everything that I can to help our working families through these unprecedented challenges. With the federal government's newly declared state of emergency, under the Stafford Act, my administration is filing a request for a federal waiver to allow our Medicaid program to more freely respond to the COVID-19 crisis by expanding medical services. During this crisis, my administration is working to ensure that those who fear that they may be getting sick will have access to the testing and treatment that they need without being saddled with costly medical bills for their care. When the federal waiver is approved, we'll be able to expand Medicaid services to fight this epidemic through the addition of new medical providers, increased access across the state, and ramped up services to many of the state's most vulnerable populations. I want to provide an update, finally, on the number of cases here in Illinois. Yesterday, we announced a total case count of 46, including individuals who have made a full recovery. Today, we have an additional 18 cases, bringing our total count to 64. While the majority of our cases remain concentrated in Cook County, our patients now span 8 counties of Illinois, including central and southern Illinois. In addition to Cook, Kane, McHenry, and Lake, those are Cumberland, DuPage, St. Clair, and Woodford counties. One of these cases is a woman in her 60s who resides at a private long-term care facility in DuPage County. I want to assure the public that members of my administration, including an infectious disease team from the Illinois Department of Public Health, are on the ground working with area officials. The facility has been locked down to outside visitors and internally, and we are monitoring every resident's health carefully with a heightened vigilance to minimize any further spread. As a reminder to our elderly residents and to their loved ones, we've issued strict guidelines around restricting visitors at long-term care facilities that we control, and we continue to collaborate with the various statewide associations to ensure that they are following our efforts with similarly strict guidelines across other facilities. Thank you very much, and as a reminder, we'll be back here tomorrow on Sunday at 2:30 p.m. unless otherwise noted, available live on our Facebook page and at illinois.gov/live video. Now I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you so much, Governor. Just want to say that I'm really grateful to be part of this team led by Governor Pritzker. We're working tirelessly following his lead to be transparent and make sure we get all the information to all the stakeholders that need to have it. So we're working day and night and making sure that everyone gets all the information you need. So thank you for your leadership. As the governor already mentioned, there are currently 64 confirmed cases of COVID-19 here in Illinois, including the initial cases, the first cases for both central and southern Illinois. Public health officials are working with the long-term care facility to identify all contacts of the new DuPage County woman in her 60s who was residing in a long-term care facility who has just recently tested positive. We are identifying all close contacts to make sure that we protect the health and safety of all residents and staff at the facility. As we have mentioned before, the nursing home residents, elderly patients are top of mind, and so all efforts are being employed to make sure that we tend to that case in the hospital and also look out for all those who are also in that facility. Infection control measures are required for all nursing homes. Additional vigilance for respiratory illness should be taken, as well as increased cleaning and visitor restrictions are to be implemented. And very fortunately, at this long-term care facility, all of those measures were taken up as we recommended them on Monday. They were immediately instituted. From what we've seen of this virus so far, older adults do tend to suffer more severe illness, and that's why our focus will be on these population. Younger adults and children may have only mild illness, but if they attend larger events or come in contact with vulnerable populations, people with certain health conditions, lung disease, weakened immune systems, that could cause the spread of the virus. It will take all of us working together to help reduce the spread of this virus. It will be stopped at the community level by canceling large events, staying home as much as possible, washing your hands and cleaning frequently touched surfaces, working from home whenever possible, and restricting visitors to long-term care facilities. These are tough sacrifices. We all have to make them. These steps will make a big difference. In addition to the cases that we saw in Cumberland, DuPage, St. Clair, and Woodford counties, cases were also identified in Chicago and suburban Cook, Kane, and Lake. We are seeing infection in all ages in Illinois, and you're seeing the spread throughout the state. Approximately 30% of the cases in Illinois are clearly travel associated. Another third are a contact of a known COVID case, and the remaining cases may not have a clear connection and therefore could be the result of community spread. Again, most of the people are either in isolation at home or in the hospital, and we've had several cases that have completely recovered and are out of isolation. At this time, there have been no deaths in Illinois related to COVID-19 cases. Yesterday, IDPH issued new guidance for healthcare providers to help them assess patients, take appropriate steps, and determine if testing is appropriate. Not everyone who requests a test needs a test. People who have symptoms and may need further assessment should start off by talking with their healthcare provider. It is not to call the hotline to get that specific one-on-one instruction. The hotline that the state set up is for the public who has general questions about coronavirus disease, rather than for healthcare providers who need to discuss diagnostic plans. To help physicians in this ever-changing landscape with updated guidelines and recommendations coming out almost daily, the state will be emailing IDPH guidance to all licensed providers in the state. Our guidance includes asking if the person, including healthcare workers, had close contact with a COVID-19 case, if there was travel from an affected geographic region, and that includes China, South Korea, Iran, Italy, and now most of Europe and Japan. If the person resides in a facility that has experienced clusters of infection that's not due to the flu, all those would be on the high priority list for getting tested for COVID-19. We are seeing a very high volume of testing at IDPH labs. Yesterday alone, we processed over 300 specimens. Total, our lab has processed approximately 1,600 specimens, representing over 800 people. While this is a growing number for us, we know that many more people are going to be and are requesting testing. We are starting to see laboratory results from commercial labs, which means we could see a dramatic increase in the number of positives over the coming days and weeks. Again, this is a very rapidly evolving situation, and we understand that people are very interested in being tested, and we're urging them to reach out to their healthcare provider to have that conversation. Individuals must go to a healthcare facility to have their specimens collected. We are working on more innovative strategies that are hopefully going to be rolled out soon. But at this time, you have to go to a healthcare facility and have your specimen collected, and then those specimens will be sent to the IDPH lab for testing. Guidance for this novel virus is changing day by day, sometimes hour by hour, and that's why we're here before you almost every day, to make sure that we update you. We want to urge people to stay home as much as possible, as the governor has pleaded, to reduce the number of people who will get sick. We don't want everyone to get sick at one time and overburden our healthcare system. I know that we have Spanish language outlets that are also covered, so I'm going to summarize my comments into Spanish. En este momento, hay 64 casos confirmados de COVID-19 en Illinois, incluso los primeros casos en el centro y el sur del estado. En el centro de Illinois, un residente del condado de Woodford de 70 años y un residente del condado de Cumberland de 70 años probaron positivo para el virus. En el sur de Illinois, un residente del condado de St. Clair de 60 años y una mujer de 70 años probaban positivo también. También estamos viendo resultados positivos en gente que están en riesgo de complicaciones médicas. Una mujer del condado DuPage de 60 años que reside en un asilo de ancianos ha dado positivo. Tenemos de trabajar juntos para ayudar a reducir este virus entre Illinois. El virus se detendrá a nivel comunitario, cancelando grandes eventos, quedando en casa cuando sea posible, lavándose las manos y limpiando lugares que se tocan con frecuencia, trabajando desde casa cuando sea posible y restringir a los visitantes a los asilos de ancianos. Además de los casos en los condados de Cumberland, DuPage, St. Clair y Woodford, también se identificaron casos en Chicago y los condados de los suburbios de Cook, Kane y Lake. Estamos viendo infecciones en gente de todas edades en Illinois. En este momento no hay muertes en Illinois conectado a los casos del virus. Queremos sugerir a las personas que se quedan en casa cuando sea posible para reducir la cantidad de personas que se pueden enfermar. Es importante limitar la carga de nuestro sistema de atención médica para los que están muy enfermos. Muchísimas gracias. And now I will turn it over to Director Ayala of the DuPage County Medical Health Department.
Thank you. Thank you and good afternoon. My name is Karen Ayala and I serve as the DuPage County Health Department Executive Director. First and foremost, I would like to thank Governor Pritzker, Director Dr. Ezike, and our County Board Chairman Dan Cronin, and the elected leadership across our country for their county for their continued support and leadership. The fact that we are announcing a case of COVID-19 in DuPage County is not surprising. At the DuPage County Health Department, our team has been working intently with our partners across the community for weeks to prepare and respond to this day. Responding to and monitoring disease outbreaks is one of the primary functions of public health, and we take this very seriously. Currently, the health department is in the process of contacting everyone that has been in close contact with the identified patient so that we can begin monitoring them to ensure they are healthy. Also, so they can be safely and quickly evaluated by medical professionals if the need arises. I am very grateful and pleased to announce that the long-term care facility was and has been prepared for this as well, and began taking steps weeks ago and again on Monday, this past Monday, to minimize the spread of disease by not allowing visitors with any symptoms, and they continue their work and partnership with us. It's important to also note that there are no additional precautions for the general public to take, but to continue to follow the steps that we've been providing and the governor has been providing on a daily basis. Please stay home if you're sick. Avoid close contact with people who are sick. When you sneeze or cough, cover your mouth and nose with a tissue and throw the tissue in the trash. If you do have symptoms of COVID-19, a fever of 100.4 or higher, a cough and difficulty breathing, please, as the governor indicated, call your doctor to discuss your situation and your condition. In DuPage County, we will maintain our contact with our healthcare providers, our community partners, our first responders, the DuPage County Regional Office of Education and school superintendents, mayors and managers, as well as many other agencies throughout the county as our response to COVID-19 has developed. Additionally, there is COVID-19 information on our website at dupagehealth.org/COVID-19. And DuPage County residents with questions or concerns, please check out our website to identify the COVID-19 hotline. Thank you. And now I would like to turn it over to my colleague, Dr. Arwady, for additional comments.
Good afternoon, everyone. Allison Arwady, I'm the Commissioner at the Chicago Department of Public Health. And really, I want to highlight, in addition to all of the public health work, following up on these cases, really making sure that we're working as hard as we can on every case. I want to highlight a lot of the other work that is happening to make sure that everyone has what they need to stay safe during this time period. So with so much news over the last few days, I know you are probably feeling overwhelmed and confused. You're wondering what you should do now. There is a time of some uncertainty. We have not been through anything quite like this before. You'll recall the governor announced yesterday that all Illinois schools will be closed from Tuesday, March 17 through Tuesday, March 30, and will reassess at that time. Mayor Lightfoot and the entire city team here in Chicago are taking the lead to ensure our children will be safe and engaged during this time. And I'm highlighting this because I know that there is similar work happening for school districts and in counties around the state. Here in Chicago, we have a lot of focus. We've exercised these plans before, and we have them in place to make sure that there will be meals for children in need. Families will be able to pick up a meal package with 3 days worth of meals at one time, Monday through Friday, 9 a.m. to 1 p.m., outside their neighborhood school. I'm not going to get into more details here. We provided some last night. But for Chicago Public Schools related updates, I'd like parents and families to visit cps.edu/coronavirus. And as always, for City of Chicago updates, chicago.gov/coronavirus. In addition here, just at a high level, we will be providing enrichment and care activities where needed at select Chicago Parks District facilities. There will be a list of those facilities online. Libraries will be open, and to prepare our parks and libraries to serve as safe centers for families impacted by the school closures. We've already started enhanced cleaning and we'll be ready to go on Tuesday. The best choice is for students to be at home with their parents, with their guardians. But we know, for example, that we have healthcare workers working in the city of Chicago. We know that we have first responders. We know that we have people who work in public safety and other really critical infrastructure needs. And so for these, and for the thousands of families who we know will need assistance in meeting these basic needs, we're making sure that we're standing up, as I know cities and counties are across the state. We're just learning what our new normal looks like as we protect ourselves and our community. I want to be clear that life does not stop altogether. We need to make sure that people are home as much as they can be. It is imperative that anyone who is sick stay home. No exceptions. You've heard us talk about vulnerable populations especially. People who are over 60, people who have underlying medical conditions. In those cases, we want folks home. If people need to go to the grocery store to get supplies, they should go to the grocery store to get supplies. But they need to be maintaining distance, they need to be washing hands, and we're really asking everybody in Chicago and really around the state, especially if you're in that younger, healthier group, to think about how, even now when you're feeling scared and worried, how you can support our vulnerable populations. Older people, people with underlying conditions, and frankly, people who will have economic and social needs, and to make sure that together and safely we're meeting those needs. I'm not going to detail for time the excellent advice around the hand washing, the cover cough, that stands true and we need it in place. But I do want to just say that we still want people to make a plan to vote on Tuesday, March 17. If there is anything that the COVID-19 response has shown us, it's the critical importance of having dedicated, competent, and truthful people in leadership at all levels. We've talked about details, it's available on the website, but we need everybody stepping up, doing this safely, really making sure now is the time to listen, make changes, and make sure that we're all taking care of each other. I've been so proud of our response here in Chicago and in Illinois so far. We continue to actively work with all of our partners and with all of you. Chicago is as prepared, Illinois is as prepared as we can be for this. We're rolling out our plans, we're working on cases, we're going to continue to share information. So please, stay well, stay safe, stay calm. It's not a time for panic. It's a time for listening to the advice and learning more to make sure you're sharing good information. With that, I'm going to ask Governor Pritzker to come back up to take questions. Thank you.
Thank you, Doctor. Thank you. Just before I take questions, two things. First, I want to thank our partners all across the state. The county board chairman of DuPage County, Dan Cronin, who's been here several times already to join us. His health officials who are doing a terrific job. The city of Chicago and the 101 other counties other than DuPage, whose health officials are on alert and working hard on everybody's behalf. So I want to just express my gratitude. We're talking to people across the state, and everybody is ready and working hard. Second thing I want to say is just repeating something that Dr. Arwady said. The polls will be open on Tuesday. Tuesday is Election Day. We hope everybody will get out to vote. If you have a mail ballot, you can put it in the mail now. It will be postmarked properly and your vote will count. You can take it to your county clerk's office to deliver it. You can also vote at an early voting site in all across the state of Illinois. Every day is Election Day in Illinois right now. So today, tomorrow, Monday, we've had hours extended so that you can get there after hours. And then, of course, on Tuesday, the polls will be open if you like to vote on Election Day itself. So having said that, happy to take any questions from members of the media. Yes, sir. Yeah.
Can you move closer to thinking about any kind of mandate on businesses, as far as restrictions on how long they're in operation or open, or if they're allowed to open at all, or anything?
Well, we of course talked, as you know, I talked directly with team owners. They're private business owners too, the people who run, the Bulls games and the White Sox and the Cubs and so on. And frankly, every private business owner that I've spoken with to talk about COVID-19, the challenges that we're facing, to ask them to make sacrifices, has been willing to step up to the plate. I am so proud of our business community in Illinois. Really, I can't say enough about that. You should all be proud too. I've talked to the utility companies. I've talked to food manufacturers in our state to make sure we have enough food for our kids on Tuesday and beyond when they're out of school in neighborhoods where they might not otherwise be able to access it, to make sure that people aren't having their electricity shut off if they can't pay because they might not be working over the next 2 weeks. So I just want you to know that the business community has been very cooperative so far. I have not looked at other business restrictions, that obviously when you talk about limiting crowds, 250 or less, and in some areas they've limited to even smaller numbers, that has an impact on businesses itself, but no further restrictions right now.
You mentioned this when you were coming in, that you saw the crowds of people out on the street. I mean, while we were driving here, there's lines out the door for bars.
Yep.
People, given it's St. Patrick's Day weekend, I get that, but this message of social distancing seems to not be taking hold in some age groups. How is the state reaching out to these people? because there are lines out there, and they're gonna be there all night.
So I want to ask you for your help in this. I'm standing here, you heard me just moments ago talk about that exact problem. I see those same people on the street. The fact is that people need to act properly at this time. People and others should be talking to those people about acting properly. I have, made it very clear that gathering in crowds is not a good idea. And of course, we've mandated very large crowds, not gather. So we're doing the best we can, but it is very helpful if members of the media will repeat this message for us. I think that there are young people who hear that, well, it's not affecting as many young people as it is older people, or it's not as impactful on young people, and they think, well, it's okay to just go on about their business the way they were before. That's just not true. You could be a carrier yourself. So when you go out in public, whether you're 20 years old, 30 years old, 15, when you go out in public, you are potentially giving somebody else COVID-19. So please go home. Please gather in smaller groups.
Just to follow
Yes.
up real quick, you mentioned that businesses have been very cooperative.
Yes.
Yet, again, you have bars that are open today that have, if not close to 200 people in them.
Yeah.
There's a lot of people in there. What about those businesses? I know in Italy, they shut down all the bars and restaurants and everything like that. What can the state do, and are you looking at options?
Look, we're always looking at all the options here. I mean, you've seen that things have evolved here over the time that we've had just these daily press briefings. So we're always looking at all the options. But at the moment, we're asking people to do the right thing. And to your point, what I was referring to is all the business people that I've spoken with directly, called them. These are many people I didn't know before. Some I did, some I didn't. Every single one of them, though, has reacted positively. So I would suggest to you that your reportage of what I'm saying will help with small businesses, too. Look, we don't want to put people out of business, but we do want people to act properly in this moment to keep the public safe and healthy.
Governor, could you walk us
Sir.
through your decision not to close daycare facilities and libraries? Some
Sure.
other states, cities have made that decision.
Yeah, and again, states and counties and cities are can make further restrictions if they choose. But look, the guidance, as you know, that we gave is no gatherings of 250 people or more. And one of the reasons we closed the schools was it was difficult to know exactly how much interaction, in the hallways and so on, that 250, when would you reach a 250 sort of number in a large school, right? Thousands of kids sometimes in a school. So there are preschools that are in those K-12 facilities. Those are shut down too. But the independent childcare and daycare and preschools, the ones that operate separate from K-12, typically are much smaller. And so because of that 250 rule, and because we're looking, at least at this moment, and again, we can evolve our guidance here, but at this moment, it does not look like we need to shut those down or ask people to close. And I think, it would additionally be a hardship given that the schools are closed. So those are remaining open. And again, those are smaller groups. You have to remember, we operate today on the scientific evidence that exists, which is somewhat limited because of the limit on the tests. You've heard me talk about this every day. I won't go on about it today, but we have a limit to the number of tests that we have currently. And so we have to operate a little bit on the basis of statisticians and mathematicians working with the scientists to determine what size crowds are okay and what size crowds are probably not okay. And those are estimates. We're operating on those estimates. Those are, again, made by experts. But that's why you see a number like 250 and not 200 or 150 or 50. Right now, the guidance is 250, and we're following that.
Governor,
Yes,
what
ma'am.
message do you have for the people that are going to these stores and panicking buying supplies in bulk?
Well, I think Dr. Ayala had it right when she said there is no need to panic here. We have the supplies are here. We're making sure that stores are getting restocked. We're working on supply chain. We also know that those stores aren't going to close. We are in communication with not only food manufacturers but also with grocers to make sure that we're making it somewhat seamless, easier for them, looking at regulations that make it harder today to restock their shelves. We want to kind of lower the barriers at the moment for them during this crisis. And I think you'll see, look, the most popular items are going to be out of stock because people are grabbing every one of them that they can find. But typically the grocery stores are reasonably large. There are other food stocks that people can access, and we would just encourage them to do that. And also talk to the grocer about when the next time there might be a restocking.
Governor, can somebody detail again how you get COVID-19 and is it airborne?
Dr. Ezike? Thank you.
So we are worried about coughing and sneezing. That is what releases the droplets that can cause the infection. You could also, why we talk about coughing into your napkin and throwing that away, is that you could cough into your hand and have the germs, the virus in your hand touch a surface, then someone else could touch the surface, touch their mouth, their nose, their eye, and get the virus into their system that way. So we definitely are concerned about the droplets that are most easily transmitted through coughing and sneezing into the air, but also through touching, getting the virus from your mouth, from your nose, and then touching surfaces. That's why we're saying consistently disinfect, frequently touch surfaces, because viruses can sit on surfaces for an unspecified amount of time, and then someone else could unknowingly touch, and then cause entry into the body.
How long does it stay in the air then? If somebody coughed in the air, how long until,
Yeah, potentially it could be a couple of hours. So we definitely want people to cover their cough. We're saying if you are coughing, stay at home. That's the best way to decrease spread to other people. And so it's really not something that we should be taking lightly. Anytime I come to even these press conferences and you hear people coughing or sneezing, you're wondering, is this guidance really penetrating? It's really important that everyone follows that. We've said over and over that even if you might not be significantly sick and feel like you can go to work and don't have any impediment to going to work, you have to think beyond yourself and think about the person next to you who could get infected, who might not do as well should they fall ill.
Of the 64 cases, do we know how many have recovered or are in the process of recovering?
Yeah.
I'm just curious.
Yeah.
Is the number, percentage, or an estimate?
Yeah. So in the process, so most of them are in the process of recovering. So they're finishing, most of the people are finishing out their home isolation or even doing some isolation in the hospital. Our first two cases are out of the hospital, out of the isolation period. So again, most of our patients, just as we've seen the stats have borne out across the world, China having obviously the most data, most people do well. And so we're counting on that to be the same for our population here in the United States, having that keen eye on people who are older than 60 and have pre-existing conditions, hemodialysis patients, liver patients. Also, pregnancy is considered one of these high-risk conditions. And then, heart conditions, high blood pressure, diabetes, any cancer patients, anybody on immunosuppressive medicines. All of those people are our higher-risk people, and so we have a special eye out for them as well.
What are the visitor restrictions to the healthcare facilities, and could that be seen statewide, or is it in the process of becoming statewide?
Yeah, so after we saw that starting to be the exponential increase of cases, I think
In other places, not in Illinois, we haven't seen that.
Yeah.
In nursing homes.
So we and also following the example of Washington, so over the weekend, we spent all the weekend with our infection prevention specialists, our long-term care facility specialists, working the whole weekend trying to come up with stronger guidance to make sure that we had a special eye towards that special vulnerable population. And so on Monday, after putting the new guidelines together, we had a call. I think there were hundreds and hundreds of nursing home administrators on that call where we said, We really don't want visitors in your facilities. We want visitor restrictions. We made a few exceptions for people who are at the end of life, saying maybe one visitor for people who are already at the end of life. We wanted pre-shift assessments for all the staff. We don't want staff coming into the facility that are sick, that are recently came off of a cruise ship, recently came off a vacation from Europe. So we said we want pre-shift assessment to make sure that the people coming to work are safe to be working with our most vulnerable population. We said that even the vendors that come in, they need to be assessed to make sure that they're safe to be passing out or doing whatever activity that they're doing in the facility. So those more stringent guidelines were rolled out on Monday. Our affected long-term care facility was already practicing those measures, which we're very grateful for. And we want all long-term care facilities, our veterans' homes, to follow these guidelines, because people in these aggregate settings where they are in a place and other people are coming in and out, it's the people who are coming in and out who are their greatest risk. And so we want the people coming in and out to be healthy and not pose a threat to the people that they're there to care for.
Are other people at that facility being tested now?
I'm sorry?
Are other people at that facility being tested now?
So we're following the appropriate protocols to identify people who have come in contact with the case. There's more vigilant, aggressive screening, like all residents are being checked and monitored and assessed every shift. So multiple times a day, they're checking to see if there's any change in any resident's condition. At the first sign of any change in symptoms, again, we know that our elderly, more infirmed patients can show sickness in different ways. So there'll be a broader brush. Sometimes elderly patients can't get to a fever of 101 or 100.4. So even if we see that normally your temperature was around 96, but now it's 98, for me, 98 is a normal temperature. But in that patient, when we see the trend and see that this is an increase, like that person would be considered appropriate for testing, because that would be considered an elevated temperature for them. So all of those more stringent guidelines are in place, and we have our team on site there. We have infectious disease consultant, we have long-term care facility experts, and we have teams at both the hospital and the facility to make sure that everybody's identified and cared for appropriately.
And I just want to add that actually a week ago, maybe more, we started having conversations with folks in other states, Washington State, for example, where we knew there had been challenges in nursing homes, because we wanted to get ahead of this and figure out what, the right thing to do was and what mistakes may have been made along the way, and to learn from that. And so that's why you hear so many precautions that have been activated around this particular nursing home as we have, the case that's been identified.
I know this is the federal government, but we've talked with several people that are coming back from Europe, Italy being one of the countries that people we talked to, and they said that when they came into O'Hare, there was nothing. I mean, they just went through customs as normal. They were asking questions of where they were. Given, I know this is the federal government, but they're also coming into Chicago. What is being done? Is there anything being done to start screening or have some sort of protocol for screening? Because we hear that there is. There doesn't appear as if it's being practiced.
Yeah, so I'm going to turn this over to Dr. Arwady in a moment, because Chicago covers O'Hare, which is what you're talking about. I will say that there is identification going on at the airport, but it's not that people are being stopped necessarily if they don't have symptoms. But let me turn it over to Dr. Arwady.
Yeah, sure. Thank you, Governor. And I'll just add on the question about the transmission piece, just one additional piece. Agree with Dr. Ezike, but really highlighting where we're the most concerned for transmission is when there is this close contact, which again is 10 minutes within 6 feet, sort of close contact. And so a lot of the conversations that we're talking about social distancing, how does this fit in, is thinking about avoiding those close contact type situations. So just adding on, I know there's a lot of information and a lot of pieces. To the airport piece, so certainly, you know, as you've heard me say, the Chicago Department of Public Health folks have been out at O'Hare really supporting that federal piece. And it is a federal decision in terms of what happens, at the airport screening. We were and are concerned when travelers are not getting full information when they're returning. I know that the CDC screeners have actually expanded so that making sure that travelers who are returning from Europe now are receiving written information, really making sure that they understand what to watch for, what symptoms, some information about how to reach out if they have need. And I can tell you that in Chicago, we are also, and this has been high on our list in terms of if there are not things in place at that federal government level, having some conversations with airlines, really thinking about what else might we need to do to fill in any gaps that are there. So
I'm sorry.
No, that's okay. Please.
But it sounds like then it's almost more self-reporting for those people coming back in.
Yeah, so certainly there are still some travelers from the very high-risk areas, from China and Iran, are continuing to get individual level temperature checks, the full thing. With the expansion of this, frankly, you've heard me say it's difficult to quarantine the whole world. There has been additional at the federal level, really working to make sure that travelers especially are getting information, right? That's what I'm most interested in. I think there is also some level of visual assessments. I'm not going to speak to that because that's not our protocol, that's not our piece, but we've been in touch, we are aware, and we're working to make sure that at least when folks are coming to Chicago, we want to make sure they're getting the good information.
Something like the phrase, stay home as much as possible, was uttered during this news conference.
Yes.
Is that new guidance? I don't recall hearing something.
We talked about it yesterday. I think what we're encouraging people to stay home this weekend. We're not saying that if you have to go to work, et cetera, right? And we're encouraging telework and other options. But I think people understand what we're trying to say. And let me just repeat: social distancing is very important. Keeping people from congregating in large groups is very important. There are other measures that we've implemented around nursing homes and other vulnerable facilities that everybody should pay attention to. Just be aware. You may not be one of those vulnerable people, but be aware that you may be around those folks. And so we're just asking people to take extra care. And that's why I called out at the beginning of this press conference, the problem of people, large groups of people on the street. I realize it's St. Patrick's Day weekend or the week, before St. Patrick's Day, but large groups gathering together, it's just not helpful. People, please stay in your neighborhood, stay home if you can.
Are you concerned that what you're seeing on the streets today could result in 120 next time we get a briefing?
Well, I'm not going to speculate about that.
Thank you, everyone.
Yep. Thank you, everybody.
Hey, if I got back too early, then people get mad.
Yeah. You gave us more than enough. Thank you.
Don't they really feel